If you are having 10 out of 10 back pain right now, I made this video specifically for you, so make sure you watch this video till the end. Hey, how's it going? This is Saman from All Things PT, and in this video I'm going to talk about exercises that you can do for severe lower back pain. It doesn't really matter if you're having severe lower back pain right now because of stenosis, herniated disc, or you lifted something heavy and you feel like you have 10 out of 10 back pain. The worst thing that you could do is nothing. But that doesn't mean you need to push through pain and piss your back even more, because that's obviously is not going to be helpful. I'm going to show you some light exercise that you could do in bed, that will help you improve your blood flow to your back, which will help you to recover faster and you'll have less pain. Before I show you those exercises, let's go over some basic anatomy first. In the lower back, you have a group of muscles called lumbar paraspinals. Now, those muscles are basically your bodyguards for your spine, and just like any other muscles, it can only do one thing, that is to contract. When you're having severe episodes of lower back pain, your lumbar paraspinals is going to contract, but it will contract so excessively that it will cause muscle spasm, which will lead to lower back pain. Our goal of these exercises are going to be to relax those muscles, which will lead to less pain. I highly recommend doing this exercise in the order that I have shown you to get the most benefit out of it. For the sake of demonstration, I have done these exercises on the floor, but you should do it on a bed, because just the act of getting in and out of floor might be enough to trigger more lower back pain. Now let's start with some exercises. Our first exercise is going to help you relax your sympathetic nervous system, which is hyperactivated when you are in a lot of pain. And when that gets hyperactivated, it also really causes the muscles to contract really bad. And we need to promote activity of parasympathetic nervous system, which will help those muscles to relax. So we need to deactivate the part of the nervous system that will cause the muscles to contract. Then we need to activate the part of the nervous system that will help the muscles to relax. In order to activate your parasympathetic nervous system, you need to start breathing from your diaphragm. Hence the term diaphragmatic breathing. What you are going to do, you are going to lie down on your back. You are going to put one hand on your stomach, one hand on your chest. So you are going to breathe in through your nose, and you are going to fill your stomach with air. Okay? And then you are going to breathe out through your mouth. Again, one hand on the chest, one hand on the stomach. Breathe in through your nose, fill your belly, fill your stomach with air, and then breathe out of your mouth. The use of the hands is that it is a tactile cues that will let you know that how much activity is happening in the chest and how much activity is happening on your stomach. You need to make sure that you are only breathing in and out from your stomach and not your chest. So the hand in your stomach should be moving up and down, but not your chest. You are going to do this breathing exercise for about a minute or so. Now, just by doing this exercise, you should be feeling a little bit more relaxed and your pain should decrease just a little bit. And if there is the only one exercise that you could do today because you have such a bad pain, this is going to be the exercise, and then you can come back later on or tomorrow to finish your remaining exercise. Okay, but you have to do this. Okay, you have to teach your muscles to relax. Now we are going to build up on that exercise, and we are going to start activating your deepest of the core muscle, transverse abdominis. Transverse abdominis is deepest part of the core, and it is connected to the spine as well, and it's one of the primary stabilizers of your lower back. When you activate your transverse abdominis, then it will kind of give a chance for your bodyguards, the lumbar paraspinals, to relax a little bit, okay? Which in turn will help you decrease the pain. To do that, we are going to continue with our breathing. So again, one hand on the chest, one hand on your stomach. Breathe in through your nose, fill your abdominals or fill your belly with air. And now, as you breathe in, you are going to pull that belly button towards your spine, as close to the spine as possible. You are going to hold for a second or two, and then you are going to breathe out. You are going to repeat this exercise for about 10 to 15 repetitions. Breathe in through your nose, fill your belly with air, breathe out through your mouth, and as you are breathing out, pull that belly button as close to your spine as you can. Hold for a second or two and relax. The next exercise we are going to do is called bent knee fallout. We are going to be in the same position, again breathing in and out, and as you are breathing out, we are just going to shift your hip out like I'm showing you in this video, making sure that the spine doesn't move. What we are doing is we are giving the lower back confidence that we can move our hip without moving our spine. Okay, so only drop your hip down to the point where your lower back is not moving, and you are going to do this 10 to 15 repetitions on each side. Now we need to breathe in and out between every repetition, just like we were doing. If you do not do that, then the whole exercise is going to be pointless. Please make sure you breathe in and out between every repetition. Now we will start activating our glutes. This exercise is best done with your legs straight, but if you are having a hard time keeping your legs straight because of your lower back pain, you can put in a bolster or a couple of pillows in between your knees like I am showing you right here. All you will do, breathe in, out, and squeeze your glutes as hard as you can. Hold for a few seconds, at least 2 to 5 seconds, and then relax. Squeeze your glutes again as hard as you can without increase in pain. That's the key word. And then you're going to relax. Squeeze, hold, and relax. Very simple. We are just going to do that for 10 to 15 repetitions. Now we are going to use the inside part of our hips, your hip adductors. You will again be on your back. You're going to put a ball like I've shown, or a couple of pillows in between your knees. Breathe in and out, hold, and press the pillow in. Okay, hold for a few seconds and relax. Breathe in, breathe out, push the pillow and relax. Once again, breathe in, fill your tummy with air. You are going to breathe out. As you breathe out, you are going to squeeze the ball with your hips, hold for a few seconds and relax. For the last exercise, we are going to activate the outside portion of the hip abductors. You are going to tie a belt around your knees like I have shown you. Breathe in, breathe out, and this time push the belt out. Hold for a few seconds and relax. Breathe in, fill the tummy with air. Breathe out, pull that belly button towards your spine, and as you do, push the belt out, hold for a few seconds and relax. All of these exercises should be in the pain-free range, and even if you can put this much effort, that is fine. We're not really trying to push through pain. What we are doing is we are giving your lower back confidence that it's not going to hurt, which will cause your bodyguards to relax. That is the theme of the video. You have to make sure that the lumbar paraspinals, the bodyguards, to relax. Okay, so for the first day, you are just going to do about 10 to 15 repetitions, and only if, like, even 5 reps is okay, better than not doing it at all. But I want you to start increasing your sets as the day goes on. So day 1, maybe 5 to 10 reps, couple of times a day. Day 2, you are going to do it for maybe 2 sets, couple of times a day, and then you are going to build on that, but that's for later video. I hope that this video helped, and by doing these exercises you have less pain. If it did, please make sure you hit the like button, and please subscribe to my channel because more videos are coming soon. And until then, take care. Bye bye.